Thank you very much, colleagues. Let's welcome the Honorable Premier of KwaZulu-Natal, Premier Sihle Zikalala, Honorable MEC for Health, MEC Nemakukusmelane Zulu. We are about to start our media briefing, where the Premier is going to be briefing us on the latest with regards to our provincial situation in terms of the coronavirus. Without any further delay, I'm going to hand over to the Honorable Premier to take us through the latest. Over to the Premier.
No, thanks, colleagues. Honorable MEC for Health, Honorable Nemakukusmelane Zulu, Honorable or esteemed members of the media, all officials who are with us today, ladies and gentlemen, we welcome you once again to this media briefing, which help us take stock of the progression of the COVID-19 pandemic in our province, so that we are kept abreast of the development. Let us start by wishing and congratulating the University of KwaZulu-Natal and the Durban University of Technology for being ranked among the world's best universities by the Times Higher Education Initiative. These academic institutions are our partners in the fight against COVID-19 and have been providing research and scientific advice that have assisted us to explore the coronavirus public health crisis in a new ways for prevention to treatment. These institutions are among 11 South African universities in this list. The ranking is a global performance ranking that judges research-intensive universities, with the full list made up of 1,500 universities or institutions in the world. This is excellent news, as it signifies growth within the knowledge economy. So once again, congratulations to you, KZN and DUT. Colleagues, this week we noted a march by artists and other stakeholders within the value chain of the entertainment industry. We wish to indicate that we are not oblivion to the plight of the entertainment sector. We fully understand the impact that COVID-19 has induced on the livelihoods of our colleagues in the art, culture, and entertainment sectors. We hear them, and we are more than willing to engage on matters they are raising. It is against this backdrop that the government announced the relief for our art and culture practitioners. We are also aware that the Department of Art and Culture has announced the second wave relief fund. This relief will be available to the art, culture, and heritage sector, as well as to the sports sector. We will request our artists to engage the Department of Art, Culture, Sports and Recreation to get more details about these relief interventions. But we wish to reinforce our message and reiterate that everything that government does is informed by medical and scientific advice. Government cannot simply do away with the risk-adjusted strategy and operate as if it is normal. As much as we understand that the livelihood are impacted by the restriction of the lockdown, even at level 2, we always have duty to protect and preserve lives. Whatever we are doing, we must never even be accused of allowing a genocide to unfold in this country. Government does not decide on its own, but it is informed, and we are informed by an advisory council which undertake a review scientifically on this issue. So we cannot afford to be summoned before the International Criminal Court one day and be made to answer for some reckless decisions that we have taken. Our message to the entertainment sector is that let us not take the law into our own hands or disrupt the economy. Let's rather engage so that we can be able to find an amicable solution where possible within the constraints in which we have found ourselves. And this should be clear. Not even government is enjoying the manner we work. There is no sector that enjoys the manner we work. All sectors have been disrupted. But let us be together. Let us engage. Let us not disrupt other sectors and other things that are taking place. With regard to COVID-19 status quo, we have heard a recent pronouncement by Minister of Health, Dr. Zweli Mkhize, that the South African storm may be over by now. This is based on the evidence of the decline in infection rates nationally. As KwaZulu-Natal, we've taken the view that it may be too early for us to celebrate the drop in infections and the drop reported. We will continuously be guided by the National Coronavirus Command Council. However, we have seen the threat of the second wave as reported in other countries such as China, Italy, Spain, and the United States of America. Our message is still very clear. Adhering to lockdown regulations, especially the level 2, is crucial to capping the spread of COVID-19. We recall that projections as we were entering the storm were setting at above 250,000. However, as the province, we have navigated the storm and registered very less numbers to what was projected. While we fully understand that we are not out of the woods, but we must give credit for every little sign of progress and achievement to healthcare and emergency workers. We pay tribute to many healthcare practitioners for an outstanding job that they have done. The projected figures were not reached primarily because of the many medical practitioners that sought to dedicate and sacrifice their lives to the cause of serving fellow compatriots of our country and the province. The confirmed COVID-19 infection hit the 26.4 million mark, with the death toll reaching 871,166. While in South Africa, there have been a total of 636,884 infections. The deaths have reached 14,779, while recoveries have climbed to 561,204. KwaZulu-Natal, as the province, we have registered 114,646 COVID-19 infections, with 2,294 deaths and 101,989 recoveries. COVID-19 numbers are going down in KwaZulu-Natal and in South Africa. All indications are that the prevalence of COVID-19 is finally going down in our province. Indeed, this decline in the rate of infections have been noticeable since the beginning of August 2020. The numbers of hospital admissions in the province have also dropped below 1,000 in both public and private hospitals. The numbers of persons under investigations admitted has also declined tremendously. The province is currently ranked second highest in terms of laboratory testing, and the positivity rate has also dropped to below 10%. Over the past 2 weeks, the province recorded 5,664 COVID-19 cases and 358 deaths. The 26th August 2020 was the last day that the province recorded more than 500 cases. The average number of cases in the past 7 days is 371. The highest number of deaths recorded in the past 2 weeks was 57. The province currently contributes 15% of the total or of the overall death rate nationally. In terms of the surveillance and epidemiology distribution of cases, we take note of the stat, and currently in eThekwini as a district, the new cases are 158, and the total number of cases is 54,177. The total number of deaths is 1,121. In Ilembe, new cases 13. The total number of cases is 6,123, and the deaths are 58. In Umkungundlovu, new cases 30. The total number of cases is 15,822. The deaths are 346. Uthukela, there are 13 new cases, 4,895 cases altogether, and 114 deaths. King Cetshwayo, 30 new cases, and 9,625 total number of cases, 201 deaths. Ugu, 6 new cases, 4,741 total number of cases, 89 deaths. Amajuba, 8 cases, which is new cases, and 6,578 is the total number of cases, and 149 deaths. Umkhanyakude, 9 new cases, 2,403 is the total number of cases that have taken place in Umkhanyakude, 54 deaths. Herikwala, 3 cases, 2,307 is the total number of cases, 50 deaths. Zululand, 10 new cases, 4,676 is the total number of cases, 55 deaths. Umzinyathi, 4 new cases, 2,481 is the total number of cases, 57 deaths. So the province, as we say, stands with 286 new cases, with the total number of cases being 114,646, and the total number of fatalities standing at 2,294. Of the 286 new cases recorded on the 5th of September 2020, eThekwini district recorded 55%, followed by King Cetshwayo at 11%, Umkungundlovu district at 11%. KwaZulu-Natal province recorded 31 new COVID-19 related deaths on the 5th of September. Among the newly recorded deaths, eThekwini district had the highest proportion. The province has had a cumulative number of 2,294 deaths. eThekwini Metropolitan Municipality contributed 49% of the reported deaths in the province, and to be specific in numbers, it's 1,121 of the deaths that have taken in place in the province. The median age of the deaths currently stands at 62. Incident by risk or incident risk by district, the overall incident risk for the province was 92 cases per 100,000 population. The incident risk has been declining since the beginning of August. King Cetshwayo district continued to be the district with the highest infection rate, followed by Hirikwala and Umgungundlovu district. 8 district has an incident risk of below 100 cases per 100,000 population. This now include eThekwini. In terms of hospital admissions and isolation, on the 4th of September, the province had 885 patients admitted in both private and public hospitals, and 73% of that were in private hospitals, and 27% was in public hospitals. Of those admitted, 197 patients required intensive care services. Private hospitals had more patients in ICU than public facilities. Among those required intensive care were ventilated, and it is 55% of people who required the support of the ICU who were ventilated. Other patients, about 10%, were admitted in high care units in both private and public facilities. As has always been, Nkosi Albert Luthuli had made majority of patients admitted in intensive care unit. Majority of ventilated patients were admitted in Nkosi Albert Luthuli Hospital. With regard to persons under investigation, a total of 403 persons under investigation were admitted in our public health facilities as of the 5th of September. Of the total PUIs admitted, none required ICU bed or ventilation. In terms of operational beds occupancy rate or status, there are 1,959 operational beds available for COVID-19 patients. Of the total beds, 86% remain vacant. Only 15% of the allocated ICU beds in public sector were occupied on the 5th of September. Infected healthcare workers, a total number of 7,043 healthcare workers were infected with COVID-19 since the beginning of the pandemic. Above 60% of the infected healthcare workers have recovered. Of the total number of the infected healthcare workers, which is 1%, and the numbers 67, unfortunately succumbed to the disease. Infected healthcare workers and their outcomes in KwaZulu-Natal as of yesterday, but starting from the 5th, in the public healthcare facilities, we have received 5,273 cases, and recoveries are 3,680. In private healthcare facilities, the total number of cases is 1,770, and recoveries stand at 1,218. The overall proportion of recoveries for the province is 89%. We then provide the list of recoveries per district, and we will provide you with that. We want to be clear. Let us all be very vigilant. Beware, the threat of a second wave is there. Although the declining COVID-19 stats are encouraging, we should always be mindful of a threat of a second wave of infection. In countries such as India, China, South Korea, Germany, Spain, New Zealand, and others, new COVID-19 are being reported daily. So you will see countries are reporting that there are new cases. South Korea is in the midst of the second wave of novel coronavirus infection forecast around its densely population capital, stemming from a holiday in May. Just as the country announced that it would be easing the social distancing guidelines in early May, new cases spark, driven in part by infections among young people who visited nightclubs and bars over the holiday weekend. All of these has prompted calls for a return of a full-scale lockdown, which is the equivalent to level 5 here in South Africa. All of this is happening for no reason other than the fact that citizens in those countries have stopped adhering to the precautions. This reality and this really should serve as a lesson for all of us as people of South Africa and KwaZulu-Natal in particular. If we do not want to suffer the same, we should never, ever be complacent. Let us be vigilant. Let us adhere to protocols and regulations. In conclusion, we wish to once again caution our people that the threat of a second wave of COVID-19 is not far-fetched. The risk of the spread of the infection is no different between levels of the risk-adjusted strategies. As we move to get our lives back, self-preventative measure is the only way we can get to zero infection rate. Let us continue with our lives, but with very serious care, not only for ourselves, but for our families and our loved ones. This is a journey, and we will beat the virus if we all do the right thing and go through this journey together. We urge all citizens to continue observing health protocols such as social distancing, wearing of face masks, sanitizing, and washing of hands. We also caution against sharing of drinks, cigarettes, cigars, and the so-called hubble-bubble. Do not behave in a manner that will put your life and the life of others in danger or at risk. Thank you.
Thank you very much, Honorable Premier. We'll move straight to questions of authority. I'll start with the colleagues in the House. I see the already hands. I'll start with you, Sihle, Karinda, Zwede, in that order.
I just want to find out from the Premier, this relief fund to the artists, the second one, I believe. When is it going to be available? When can they start, getting information as to get it? And then the second one is this second relief fund not because of what the artists have done, blocking the freeways recently? That's my question.
Thank you. Karinda? Thank you. Zwet.
I'd like to get an update in regards to the economic costs of COVID, because in July it was about 30 billion, if not mistaken. I'd like to get that the latest figures.
Awuzwakalanga kahle ngicela ukuthi kancane.
Okay, bengicela i-update in terms of the economic cost of the COVID on the province.
Oh, okay. Thank you. I'll hand over to the other brother.
No, thanks. I think I will take the first and the last question, and the MECs will deal with the second question. No, it is not because we are not providing the relief because of the protest. We had already discussed even before that there should be interventions that are done to assist through intervention. So it is not because of that. And when is it available, we are going to ensure that the department announces that publicly. There is, you will know, nationally it was announced and it is going on. And I think in the province there is something that was done, and we will look on that it is announced, and then those who should participate and benefit will be guided. We're dealing with a sector that is organized to a certain extent, and I know that there's been engagement between the department and the sector, and we're going to ensure that we reinforce that, so that those who are involved or who are expecting to benefit are not found wanting. With regard to the cost, it might not be possible to give accurate numbers now, because the cost you are referring to is impacting on various departments. It comes from various sectors. If you deal with the economic sector, if you deal with the cost in the economy, so we can get those stats because it should include all sectors of the economy. But the most affected one, you will know, will be your tourism through the closure of the borders. And you have heard the cry that people are trying to convince government that we should move either to level 1 or opening up of the borders. And I think we will be guided by scientific analysis to that aspect. Many of the hotels, however, are opening now. And I think by the end of September, all hospitality facilities will be in full operation. So that's what. The art and culture is also affected, as we are not able to host events, which has been the anchor of their income. But we will engage with them. We also know that other sectors are affected, but to the different level. There are those that are affected to a point where they've closed, but others are navigating, trying to ensure that they try and manage the situation through various interventions. I will then allow MEC to address the second question.
MEC.
Good afternoon, ladies and gentlemen. Thank you, Karinda, for that question. Immediately when we realized that our numbers, we were safely looking as if our numbers were going down, one of the first exercises we conducted as a department was look at the field hospitals firstly that we have put up, but secondly look at the quarantine sites that we had contracted outside of our own facilities. We have 4 field hospitals that we have put up. The 3 are the ones that we previously were referring to as temporary structures, but MEC Nkonyeni Premier has corrected us and said we must call them alternative structures because they use alternative material to build, and they actually last far much longer than 2 weeks and 2 months, and they probably, we are told they last something like 15 years. So we've got 3 of those. The first one is in Claywood, and it has about 240 beds, as you would know. I think the majority of you, we've been there more than once.
The second one is in General Kizenga Hospital. The third one is in King Cetshwayo Hospital. Now, our strategy as the Department of Health was clear that we wanted to link the field hospitals with the hospitals themselves, because we did foresee a possibility that we might want to use the field hospitals for a bit longer, firstly, or we might not want to take them down immediately when we are not sure of how far or how the virus itself is going to behave in the next 12 months or so. Having said that, linking these field hospitals or putting them within our own facilities has then allowed us an opportunity to extend the beds that we have in our facilities. So we will continue utilizing the field hospitals as COVID-19 for now. But if in the next 2 to 3 months we find that our numbers have gone down as a province, we are then looking at other options on how best can we utilize these facilities as extra beds within our own facilities. So in reality, when we look at them, these are facilities we might not necessarily want to take down because we think they actually can add value to the facilities that we have. However, that is something that we are engaging between ourselves as the Department of Health, Treasury, and the Department of Public Works, because that is how we got the field structures, because Public Works is our implementer of choice. You would know, we probably announced at the beginning that we had a contract of a particular time with the owners of the field hospital. So right now, we are looking at the different options on what does it mean if we wanted to either buy them over or extend. So we are looking at that. But bottom line to your response is that the three field hospitals are going to continue. The fourth field hospital is the one that is in Royal Showgrounds in Mgungundlovu. You would remember that we put up more than 200 beds there, and we had a contract of 6 months which lapsed at the end of August. So looking at the fact that our numbers have dropped in that particular area, we are thinking of not extending that facility, because it would mean we would be paying for beds that we are not utilizing. However, we are a bit worried, and we are careful of not closing down all the beds quickly when we are not sure of how the virus is going to perform moving forward. But the one that is in Mgungundlovu in particular looks like it is going to be closed down because the contract has expired anyway, and it might not be prudent or financially prudent for us to actually extend. So that is in relation to the field hospitals. In relation to the quarantine sites that we booked or that we got into a contract with that are outside of our facilities, I'm talking here about the different lodges, hotels, and so forth. We are negotiating with some of them in the different districts to pull out of the contract, because some of them we got into a contract of about 6 months with, because we expected, according to the numbers that were projected, that we actually were going to get numbers, and that these higher numbers, and that these higher numbers were going to run for a bit longer. So we are negotiating with other facilities to shut down. But our approach is that we don't shut all of them down immediately. We see at the needs, and what we've started doing is moving patients into facilities that are manageable. In one district, for instance, Otugela, I'll make an example. We have more than 3 quarantine sites that we had, and we have closed the 2 quarantine sites. We moved all the patients into one because there is enough bed and enough space. So that is the process that we are engaging in all the facilities. We are hoping that if the numbers go up again, we then will be able to go back to the same service providers if there is a need. But with the number of beds that we have created within our facilities so far, we are quite comfortable that for the next 3 to 4 months, we might be able to manage the infections if the numbers don't go up too much. Thank you.
Thank you very much, Honorable MSc. Let me have take the last round. We'll start with Tammy, who is behind me, and Karinda. Yeah, that will be the final leg. That order. Press it up. Yeah. Yeah. Kubaki voice yake izwa.
Premier, last week we were thinking that it's of lawlessness on the freeway. We saw the transaction when we went to buses blocked the N2, and in the same week we saw buses blocking the N3. Basically, just speak to that issue as what presently, the Premier makes of that and what's to be done to address that issue. Issues like that, not necessarily a particular one, but issues that arise like that. And secondly, there's been speaking on the issue of the economy after the lockdown, there's been a lot of talk of the economy that will emerge after the lockdown being the representative of the entire population of the province and of that of the country. So can you tell us what the province is doing to make sure that when we come out of lockdown, we have an economy that basically caters for all the entire population?
Okay, thank you. Karen?
The numbers are still at a high level despite a decrease in daily infections, and just that warning, please.
Okay. I think that those are the final questions. I will hand over. Emerson?
No, thank you very much. I'll just respond to the question that Karinda asked. And in fact, I don't think it's a question really. It's just saying what to say to the people in relation to behavior. I must indicate, Karinda, that we are extremely worried by what we see on the streets, what we see in some restaurants, and what we see in entertainment spaces, where people suddenly have just decided that they are going to throw caution to the wind, don't put masks on, don't social distance, don't wash their hands, or don't sanitize. We are saying, and I think this is something we have always said at the beginning, probably we've not said enough right now, the coronavirus does not move. It is the people that move, therefore, that move the virus. So we are requesting people to actually continue to adhere to the regulations, always wear a mask wherever you are, always maintain a 1.5 meter distance between yourself and the next person, wash your hands with water and soap, or utilize a sanitizer. This is what we say to our communities. Legally, we are on level 2 lockdown. But in thinking and in behavior as people, we must continue to operate as if we are on level 5 lockdown. The reason why it should be our minds who are actually guiding us, it's because we will then be able to understand that the country had to open because of economic needs. By the way, all of us needed to start going to work because all of us were beginning to have a challenge. But in us going back to work and ensuring that the economic activity continues, it means we have to take responsibility for our own lives and the lives of those that we love, our neighbors, our friends, and our family. So we are calling on people to go to work, come back home, go to the stores, go shopping only when it's necessary for you to do so. Do not linger around. Only visit when there is something substantial for you to do there, but let's not go and be, as if it's business as usual, because it's not business as usual. The Premier just indicated now a number of countries that are actually experiencing the second wave. When you look at the history of the US, and I think we should, and I would like the media to probably focus on that a little bit, you will realize that immediately when the lockdown regulations were reduced, people, and young people in particular, took that as a messaging that was saying coronavirus is no more, therefore they can do as they please. And immediately after that, or within 30 days of the lifting of lockdown, you could see numbers in the US increasing incredibly. And the impact of the second wave is far much more dangerous from what we've seen so far. It's far much more dangerous than the first wave. So we are calling on our people and our young people and those that are still active in particular to be cautious, to be responsible in everything that we do. Because if we don't do that, it means the fate that has been reached by the US, by Spain, by Italy, by Britain, by Brazil, by India, is something that is actually going to come to us. And when you look at the numbers of the people that have passed on in those countries, the numbers are extremely high than what we have expected, than what we have experienced in South Africa. So we are really calling on our people to be responsible with the level 2 lockdown so that we are able to stop the second wave, that it doesn't come to us, because we don't know what impacts it's going to have on us. Thank you very much.
Thank you very much. Yes, we'll come back. The Honourable Premier is going to summarize for us in Zulu as well. Thank you.
Thanks. Firstly, okokuqala masibingelele kunina nonke sidlulise ukunamukela osukwini lanamuhla kule media briefing la siqhubeka njalo nokwazisa abantu bakithi ngesimo esibhekene naso. Ngiyafisa ukuqala ngokukhalalisela i-University of KwaZulu-Natal ne-Durban University of Technology ngokuthi babe ingxenye yama-universities okuthe uma ku-assesswa kwatholakala ukuthi asebenza ngendlela eyiyo nangendlela esezingeni eliphezulu. Babe ingxenye yama-institutions awu-11 akhona la eSouth Africa abalwa njengamanye ahlonishwayo ngumsebenzi omuhle ezweni emhlabeni wonke kuma-institutions angu-1,500 a-assessiwe. Sithi halala kwi-University of KwaZulu-Natal nakwi-University of Durban nakwi-Durban University of Technology. Kuleli sonto esivela kulo sibonile abafowethu nodadewethu abakwi-entertainment industry emkhakheni wamaciko nokunandisa bengena emgwaqeni betoyiza bekhalaza ngokuthi i-lockdown iyaba-affecta kakhulu. Siyafisa okokuqala ukuthi siqinisekise ukuthi izwi nomyalezo wabo siyawuzwa futhi siyawazi. Siyazi ngoba ukuvalwa kwe-art and culture industry nokuma kokusebenza kuyinkinga ebhekene nathi hayi kule industry kuphela kodwa kwi-industry kuma-industries onke akhona. Siyafisa ukusho ukuthi noma kunjalo izinkinga esinazo masihlale phansi sizixoxe ndawonye. Masiqinisekise abakwi-industry ukuthi sibonile futhi siyaqinisekisa ukuthi i-department iyakhipha i-relief yesibili. Yingakho sithi masibamsaneke bakwazi uku-assessa leyo relief. Nakuba sikhungathwe i-lockdown singenakwazi ukwenza yonke imicimbi esifisa ukuyenza, siyacela ukuthi labo aba-affected bangathathi bavale imigwaqo baphazamise ukusebenza komnotho, ngoba nathi njengohulumeni siholwa imbiko evela kochwepheshe abadila naso lesifo. Angeke kube kuhle ukuthi sithathe inqumo ezireckless eingakhanda ukuthi inqumo engabhekisisiwe kahle eingakhanda ukuthi kutholakale abantu beshona ngobuningi ngenxa yokuthi asibhekanga kahle. Sizwile uma sibheka isimo se-COVID-19 ungqongqoshe wezempilo uDokotela uZweli Mkhize esho ukuthi izwe lakithi selidlule kwistorm. Noma kunjalo siyafisa ukuxwayisa abantu bakithi ukuthi isimo esikuso sinzima kakhulu. Singazibona sibuyela emumva uma sizoyekelela. Yingakho sithi kuma wonke umuntu okhona KwaZulu-Natal neSouth Africa yonke masiqhubeke nokuyivikela. Siqhubeke ne-social distancing, siqhubeke nokuwasha izandla, nokusanitizer, nokufaka ama-mask kuzo zonke indawo. KwaZulu-Natal kumanje ama-cases amasha esiwatholayo aseba ngaphansi kuka-500 ngosuku. Kuyokhumbuleka ukuthi kuke kwakhona isikhathi la se-reporter close to 3,000 a day. So namuhla singasho nje ukuthi osukwini la izolo ama-cases areportiwe angu-286. Kodwa siyafisa ukugcizelela abantu esebeke baphathwa yilesifo KwaZulu-Natal bebonke kusukela siqalile bangu-114,646. Kanti abantu abasishiyile emhlabeni ngenxa yalolu bhubhane bangu-2,294 lapha KwaZulu Natal kuphela. Kungalokho-ke sisho ukuthi noma i-wave isifikile, noma iy'namba zehla, kodwa sonke masiqhubeke sizivikele kuzo zonke iy'ndawo. Abantu abasebenzi bezempilo abake baphathwa yilesi sifo bebonke bangu-7,043. Abantu abathe badlula emhlabeni ngalesi sifo bangu-1%, and uma sikubheka ngokwama numbers bangu-67. Siyafisa ukuzwelana nemindeni yabo. Masisho-ke ukuthi noma kubukeka engathi izinga nerate esikuyo manje iyehla, kodwa kusezandleni zethu ngamunye ngamunye ukuthi i-second wave ye COVID-19 ingasifici njengezwe lethu. Labe kuyangathi ngabe sonke siqhubeka ngendlela sikwazi ukuthi sifinyelele la sithi akekho umuntu othelelekayo. Ngalokho sithi masiqhubeke senze lokho kuthiwa i-social distancing, siqhelelane uma sisey'ndaweni zomphakathi, sifake ama-mask, sisanitize, siwashe izandla. Masingalokuthi siphuze entweni eyodwa, kwinkomishi eyodwa noma ngeglasi eyodwa, masingashiyelani uma ubhema umuthi ushiyela omunye, ngakuba ubhema nanoma yini eyenziwayo. Siyacela ukuthi siqhubeke sonke sizivikele ukuze singayiboni si-affectwa i-second wave njengamanye amazwe esesiwabonile e-affecteka afana no-America, South Korea namanye. Siyabonga.
Sibonga kakhulu. We'll adjourn here for today, and until next week. We might see you on Tuesday, but we'll advise you. Thank you very much.